All right, so let's go over what the research says regarding the use of acetaminophen or Tylenol during pregnancy and the recent claims by our administration that the use of acetaminophen while pregnant causes autism.
Don't take Tylenol. There's no downside. Don't take it. You'll be uncomfortable. It won't be as easy, maybe, but don't take it. If you're pregnant, don't take Tylenol, and don't give it to the baby after the baby is born.
This is obviously a pretty big claim, but does the science really support that statement? And the answer is no. There is some nuance here though, and I want to talk about it with you. I want to talk about the study done in Sweden that was published in 2020, but before I do want to acknowledge that I believe majority of time mothers are trying to do the best that they can to protect their children when they are in the womb and when they are outside of the womb. And so hearing information like this can be, understandably so, really scary. If Tylenol can't be taken, then what is safe, right? I'm sure that's a question that a lot of women were asking after that press conference, because we already have established guidelines that say you cannot take NSAIDs, so for example Motrin during pregnancy and for the first 6 months of a child's life unless it's specifically prescribed by a healthcare provider. And so what now? What if a pregnant woman has a fever or an infant has a fever? The safest option still remains Tylenol. In fact, if fever in pregnancy or infancy is not addressed by a licensed healthcare provider like your primary care physician, then this can be dangerous. If you found this press conference scary and confusing, I'm so sorry. I urge you to always seek medical advice from your primary care provider or another licensed healthcare provider that is physically treating you. All right, so as of now, one of the largest and most comprehensive studies examining the potential link between acetaminophen use during pregnancy and autism is a study published in 2020 by researchers from Sweden. And so this study is considered one of the largest and most detailed to date because of its large sample size with over 2 million children, the use of sibling comparisons, and its long-term follow-up. So in the initial analysis, they used statistical models that did not compare siblings, and these models did show a slight association, meaning possibly that acetaminophen use during pregnancy was linked to a small increased risk of autism and ADHD. Then, to account for shared genetics and environment as potential factors, the study also analyzed data from full sibling pairs, meaning siblings that share both parents, and they compared the outcomes of these pairs. And when they compared the siblings, they found no evidence that acetaminophen use during pregnancy increased the risk of autism, ADHD, or an intellectual disability. If only the siblings exposed to the medication had the condition, that would suggest that the medication might be the cause. However, if both siblings have the condition regardless of who was exposed to the Tylenol, then this suggests family factors may be the real reason. And that's what this study suggests, familial confounding. And so what does familial confounding account for? Things like genetics, environment, socioeconomic status, parenting styles, other factors besides acetaminophen being linked to the development of autism. There still were limitations to the study, and more research of course is warranted, but to flat out tell women to not take Tylenol and to also not give it to their children is a very dangerous claim, not rooted in evidence-based science. Fighting misinformation in medicine is crucial because it directly impacts patient health, safety, and trust in our healthcare system, because that's what misinformation like this does. People will hear these statements made and take it as fact, when that's simply not the case. As a general rule in medicine, we recommend using a medication for the shortest duration possible at the lowest therapeutic dose possible, and we're always weighing risk versus benefit. And of course, this is going to apply in pregnancy as well. And while Tylenol is considered to be a safe medication to use during pregnancy, even Tylenol can cause harm if it's taken incorrectly. So it's important to always follow the dosing guidelines. And again, if you have health-related questions, ask a trusted, licensed healthcare provider, one that's treating you physically. Accurate, evidence-based information empowers individuals to make informed decisions, promotes effective treatment, helps prevent harm caused by false, misleading claims. In an era where misinformation spreads rapidly through social media, it is vital that the medical community actively promotes transparency and science-based medicine. And this is to ensure that the public has access to reliable information and to uphold the integrity of our healthcare system.